Psychologists commonly refer to co-occurring disorders as typically involving a substance-related addiction at the same time as a mental illness. Along with drug abuse, people with co-occurring disorders often suffer from certain mental health struggles such as post-traumatic stress disorder or PTSD, bipolar disorder, depression, or anxiety disorders. In this video, we'll talk about the details of co-occurring disorders, abuse, and mental health. Patients with mental instability or a family history of psychological disorders are often observed to have a substance-related addiction. This relation also holds true in the case of patients with substance use disorders exhibiting mental illness. The various situations which present these dual diagnosis syndromes often include a prescribed drug dependency and social anxiety, depression, and alcoholism. The reliance on substances can add to or even complicate the treatment needed in learning to manage mental health disorders. In the same way, mental illness can pose new obstacles when it comes to a person in their treatment and recovery from drug addiction. This is why it's so important for professionals in the drug and alcohol treatment industry to understand both addiction and mental health. Cognitive behavioral therapy. More than a prescribed medicine, a patient with a co-occurring disorder might react best to cognitive behavioral therapy. It helps the patient deal with psychosocial anxiety issues, promotes mental health and stability. It also prevents relapse by eliminating a drug-based dependency. The effects of co-occurring disorders can cascade into all personal areas of the patient's life. These include financial troubles, family problems, the stress of hospitalizations, sexual or physical abuse, and other medical complications. These can come up in treatment and must be dealt with in a safe, supportive environment. Integrated treatment programs. An integrated treatment plan incorporates both psychotherapeutic and occupational therapy to reverse the co-occurring disorder. Integrated treatment programs include activities that help patients explore life while they fight drug abuse and mental health, recover using holistic treatment methodologies, and identify solutions to their family problems, as well as employment support services. The duration of the program may last up to 24 weeks, provided the patient does not opt out of it. Treatment center offerings. There are several treatment centers specializing in co-occurring disorders or dual diagnosis. In many cases, the patient attending the rehab session avoids opening up to the medical attendant at first. To offer treatments to patients and address their core underlying issues, the medical staff conducts several biopsycho examinations for the attendees. These assessments are crucial to obtain extraneous information about patients with bipolar disorders, drugs or alcohol dependence, anxiety, depression, psychosis, and more. Several drug and alcohol addiction treatment hubs enroll people with co-occurring disorders in a comprehensive treatment program. These programs may include an alcohol rehab plan, outpatient therapy, and drug rehab arrangement. These treatment plans explicitly consist of nutrition and addiction programs. Since the mental capacity and emotional quotient, EQ, is related to a person's surrounding environment, the treatment centers chart out a family program for the patient's overall well-being. Family member issues. All in all, to fight the onset of behavioral challenges in a patient with a co-occurring disorder, one must resort to the psychotherapeutic solutions instead of a big box of medications. An integrated treatment approach has been successful in addressing several critical substance cases of abuse and mental health disorders. At Opus Health, we are familiar with co-occurring disorders, and many of our patients in recovery discover how to manage their symptoms. Through willing to stay sober, remaining in the community, and taking a path to a better life, our patients have found how to return to jobs, build families, and overcome disorders as best they can with the help of caring professionals. If you or a loved one needs help, call us at 949-284-7185. And if you enjoyed this video, be sure to like, comment, and subscribe.